A couple of our biggest services are orthopedics and podiatry. Beyond that, we have general surgery, gastroenterology.
One thing I do like about orthopedics is the opportunity to take care of people throughout the whole spectrum of life, from kids with broken bones to athletes trying to get back to sports, to people dealing with arthritis that's affecting their daily life and the ability to get them back and going again.
It was a normal Sunday morning and I got a text message from my coach saying, hey, you're going to be at summer basketball day in Marshalltown. It was like 2 minutes into the second half and I got the offensive rebound and my foot stuck and I kept twisting and everything and I lost traction and I just fell. We originally thought everything was fine, just maybe a couple sprains, and that was it. And then we went to Bartell the next day. Then he broke me the news that, hey, unfortunately, you tore your ACL, you're gonna need surgery.
I was just struggling with my knee, and I was doing some chiropractor trying to get it worked out, but he didn't want to change my lifestyle. I like working out, I like playing my pickleball, so I thought that this was my only option. And I was glad that I picked Dr. Bartell, came to the Grundy County Hospital, and had everything done here.
One thing I always try to do is to really understand what the patient wants, why they're coming to see me, how does their problem affect their life or limit their life, and adjust my treatment to be specialized for that.
It was nice to be able to come to Grundy County Memorial Hospital to have my surgery and my rehab.
We pretty much see anything you can think of, from balance disorders to geriatrics to kids to athletes, anything you think of from a therapy standpoint. I always ask, what are your goals from here? What can we do to help you and what can we do to get to that point? And so part of our goals are your goals.
Ever since I've been here, it's just like everyone starts like knowing me, so I start getting connections and like bonds with everyone here. And so it's kind of like another family.
Seeing a familiar face and knowing that you can trust the people that are taking care of you, you can't put a price and a value on that. It's invaluable. It's amazing.
Grundy County Memorial Hospital can offer me all the things that I need with exceptional care and physicians that I don't have to travel, but come right here to Grundy County Memorial Hospital.
Access to care is one of the biggest obstacles for many people. And so we are extremely passionate at Grundy County Memorial Hospital about making sure that patients have access to the care they need.
The idea of a patient coming here for a total hip surgery, a total joint surgery, or coming here to be as an inpatient when they don't feel very good and they need some specialized care, the ability for them to stay local and stay in this own community allows great things.
In terms of technology, whether it's imaging with CT or MRI, or in terms of surgery with arthroscopy, we can essentially do whatever here that for example, we can do in Waterloo or in larger facilities.
For me, it was a clear choice because I'm really close to here. I know a lot of people here, so it just makes this place really easy to come to.
What makes us the clear choice is knowing that you are going to get the best care that you deserve every time you come here.
We really specialize in orthopedic surgery. We have 2 orthopedic surgeons that come here.
We've been doing total joint arthroplasty for 10 years. Probably the #1 reason we do joint replacement surgery is for pain, to relieve pain.
It started, I had injured my knee quite a few years ago, and it just became more and more painful to the point where I just really couldn't enjoy doing anything anymore.
I had been put on an arthritic medication to help with some of the pain, and it worked for the first couple of years, but then after that, nothing really. My family doctor recommended Dr. Cooper to come and see. So they made the appointment and he looked at the x-ray and he said, yes, you definitely need hip surgery. And I said, fine, schedule it. And 2 weeks later, here I was.
I see all my patients beforehand. Obviously, I've followed them usually for at least months and if not years. We've tried the anti-inflammatories. I've sent them to physical therapy. We've usually given them several injections. And then I'd show them their x-rays and we go over the surgical procedure beforehand. Now we have the UV light system, which is an added level to ensure pretty much no infections.
What's unique about the system is that it's another step after the manual cleaning that we can do to make sure there's no more bacteria left in the room. By using this system, after it's gone through its cycle, the room is 99.9% bacteria free.
It didn't really require a lot of outside research to see, do I think this is the best? Just talking to a number of people and knowing what they were investing in this new equipment, it just kind of solidified the decision to have it done here. community this size typically doesn't have this type of facility, and I think the advancements they've made in their surgical wing and things like that just gave me a level of comfort that I didn't feel a need to be running around looking at other facilities to have that done.
I feel what sets us apart here at the Grundy Hospital is because we are small, and so a lot of us already know our patients that come through the doors. We treat them just as if they are our family and friends, because they truly are.
We've seen Jess and some of the nurses outside since my surgery, and they always come over and say, "How are you doing? It's so glad to see you out." And it's super. Small community, you know people, and they care about you.
Being a community hospital, you know more of the people. Kind of gives you a comfort level, and talk about being personalized care.
The quality they get both preoperatively, during surgery, and postoperatively is excellent. I think in the smaller hospitals like this, you get a unique group of people that know the patients, often very interested in not only their surgical time, but their time afterwards and before surgery.
I had really, really great care, and the doctors, the nurses, everyone here was super, and anything needs to be done again, I will be back here.
It was just very hands-on and just very supportive, and I was just real pleased with that. I don't think I could ever try and improve on the service I got while I was here, to be honest with you.
Even though we are small here at the hospital, we are up to the best practices that other hospitals are doing. And just because we're small doesn't mean we can't do great things.